Good evening, everyone. Myself Vishaka. I'm a senior program associate at WRI India. First of all, a warm welcome to everyone who have joined here for today's webinar session. Some of you might be already aware of the initiative under Nurturing Neighborhoods Challenge. But for those of you who are new, Nurturing Neighborhoods Challenge is an initiative hosted by Ministry of Housing and Urban Affairs, anchored by Smart Cities Mission, and supported by Bernard Banlieue Foundation, and technically supported by WRI India. And this is a 3-year long initiative, and we are close to finishing this phase currently. And we have been sharing our learnings across the NNC cities through different learning sessions and webinars so far. So this particular webinar, we'll be focusing on how our nurturing neighborhood cities are focusing on the urban environment in and around the early childhood development centers. So basically, we have three highlight cities from which we will be telling the stories on the transformation that they had made in their cities. And people from the ground would be narrating the story for all of us. So before we start, we have few housekeeping points. Kindly keep yourself muted throughout the webinar, and we'll also open up the screen to everyone for a short Q&A session if time permits at the end of the session. And meanwhile, you can always post your comments and questions in the chat box. Moving on, I would also like to welcome our key speaker, Ms. Priyadarshini Mohanty. She has joined with us. She is the Early Childhood Development Specialist at Government of Odisha Women and Child Development Department, who has more than over 2 decades of experience in the sector. So as I was saying, today's session is on reimagining early childhood development facilities as crucial public cities, and we would be highlighting 3 stories from the cities. So what is early childhood development centers are those which would support development in children, basically in education, in the early education, nutrition, and health aspects. Thereby, Anganwadi centers, public health centers, primary health centers, and nutrition rehabilitation centers are the primary early childhood development centers that our children in Indian cities eventuate. So why are we focusing on ECD centers? So let me take you through some pictures. These are ECD centers in our Indian cities. So if you look at this picture, this is an Anganwadi premise in our city. And the teacher from this Anganwadi reports instances of vandalism that people outside the Anganwadi, people from outside the Anganwadi in the neighborhood are coming in and posing threat to the children in this Anganwadi. So would you be happy about sending your child in this Anganwadi? Going to the next picture, this is also a picture of an Anganwadi. And what could be your concerns if you had to send your child to this Anganwadi center? This is another picture of an Anganwadi from where Avantika, who attends this Anganwadi, says that the painting of the mermaid and all on the wall looks really nice and she likes the painting. But what else she has to do in this Anganwadi center? She has nothing to play with or nothing to look at. Based on these stories, we have a short video to present. How safe are these spaces for our children to access? These are the spaces that our children access the most on a daily basis and spend a lot of time in these centers, right? So how much quality experience are these centers able to provide to our children which supports their development is the question. So with that thought, I would like to invite my colleague, Chaitali to present this Menti exercise for you.
Thanks, Vishak. All scan the QR code that you're seeing on screen right now, and or click on the link and enter the code that you can see. All right, we are getting some responses. We want everyone to please think a little on the videos that you just saw and the context that Vishakha just mentioned about these spaces. Think of any words that come to your mind when you think of these places and what are the issues that people would face while accessing them. Any words that come to your mind. You can enter. Okay, we can see clear footpaths, the absence of clear footpaths. They're barren. There's nothing stimulating for children to see. Lack of walking space, lack of play space, bad lighting, unattractive, no space to play. It's not enough space, somebody thinks. Okay, it's dirty, it's not maintained. There are level differences. Nice. That is definitely a deeper thought given there. The distance from, I'm assuming that the distance from home is what they're talking about. Broken footpath, lack of cleanliness, construction waste, unsafe. Okay, we have about 35 responses, 38. Lack of interactive spaces, stray animals. Okay, interesting. There are vehicles, there's no space to play, it's not organized, there's waterlogging, it's hot and sunny, so it's not shaded, it's a gloomy environment. All right, I think, yes. Thank you so much, everyone, for participating.
As we move on, let's see how can we reimagine these spaces based on these issues, context-specific issues from different cities. How do we reimagine these spaces? So I welcome Ms. Madhura Kulkarni, who's our project manager from WRI India, to take it forward. Yeah.
Thank you. Thanks, Vishaka. Hello, everyone. So I think we all saw what issues these children face while they access the early childhood development centers. But why are we talking about this is that they spend most of the time here. And while they are spending time, they are generally with caregivers. They could be their Anganwadi teacher, they could be their mother or anyone. So thus, it doesn't just limit to the activity of that school or Anganwadi or the primary healthcare center, but it goes beyond that to have a lot of community activities which also happen at these centers. So many times these Anganwadis also act as immunization centers in certain cases. So then this becomes more like a community space, or sometimes health checkup camps happen where there is space and all that. So now as part of this Nurturing Neighborhoods challenge, currently 10 cities are reimagining public spaces for young children and caregivers. And this is one of the approach which has worked in the 10 cities where these ECD facilities are becoming public spaces for community and public spaces for communities post operational hours. And reimagining these public spaces, it's a very multi-pronged approach where it includes understanding what is happening on ground, to understand understanding what is the involvement of the community, what are the issues on ground, involving the stakeholders in the process of retrofitting it, improving it, and then also goes towards creating programs for scaling such projects. And apart from that, while these projects are implemented on ground, the most important aspect that has emerged out of our learnings from the Nurturing Neighborhoods challenge is having a constant periodic evaluation and monitoring mechanism for all these projects, so that they once they are retrofitted, they are still usable in a long term. It is well maintained and monitored. So various cities are reimagining such spaces where they are creating safe waiting spaces. They are retrofitting these facilities with child height amenities. They are creating play areas wherever there is space, and they are also improving access to such spaces. So these are the cities who are actually trying to improve their facilities. But today we are going to look at the three cities of Kochi, Vadodara, and Bangalore, who has these three cities are scaling spaces across their city, and there are very unique ways through which they are doing it. So we'll be hearing from these cities today, and also these three users of these spaces from these three cities, who would be interacting with each other and learning from each other, that what are the mechanisms that they have used to create such better public spaces around ECD amenities.
Thanks a lot, Madhura, for briefing our initiative. So, as she said, let's move on to the first story. The first story is from Kochi. So, as you can see from the image, Kochi is in the process of improving their outdoor play spaces in 29 of the Anganwadis. And let's look at it and through a video and understand how are they transforming these spaces.
Initially, in this Anganwadi project, CSML concept was to technologically upgrade the existing Anganwadis. And we had chosen about 29 Anganwadis in the neighborhood area of Fort Kochi area in Division 1 to 5, where this minority community was living. After several discussions and meetings, we understood that rather than a technological approach, we need an infrastructure upgradation. Along with this, we need to address an behavioral change issue for the outdoor play spaces. We thought of changing the design proposal since there we found an issue like the existing front yard and backyard as well as the terrace space has to be well utilized to improve for a safe outdoor play spaces.
പഴയ അംഗനവാടി എന്ന് പറയുമ്പോൾ നമ്മൾക്ക് കൂടുതൽ സൗകര്യങ്ങളൊന്നും ഉണ്ടായിരുന്നില്ല. നമ്മളവരെ ഒന്ന് ഇരുത്താനുള്ള സൗകര്യങ്ങൾ നമുക്ക് അതുപോലെ തന്നെ നമ്മൾക്ക് ഇങ്ങനെ കുട്ടികളെ കിടക്കാനുള്ളതും പിന്നെ ഭക്ഷണം കഴിച്ച് കഴിഞ്ഞ് കൈ കഴുകാനുള്ള സൗകര്യങ്ങൾ അങ്ങനെയൊന്നും നമുക്ക് ഉണ്ടായിരുന്നില്ല.
ഇത് CSMൽ നമുക്കിത് ചെയ്ത് തന്നപ്പോൾ മൊത്തത്തിലൊരു കളർഫുള്ളാണ്. അതായത് ക്ലാസ്, പിന്നെ കുട്ടികളുടെ ടോയ്സ്, കുട്ടികൾക്കുള്ള ചെയറ്, ടേബിള്, പിന്നെ ഞാൻ പറഞ്ഞില്ലേ പ്ലേ എക്യുപ്മെൻറ്റ്സ് എല്ലാം ടോട്ടലി മാറിയപ്പം മൊത്തത്തിൽ ചേഞ്ചായി. അവർക്ക് ക്ലാസ്സിലോട്ട് വരാനാണെങ്കിലും എന്നാലും വന്നു കഴിഞ്ഞാൽ അവർ ഹാപ്പിയാണ്. പഴയ അംഗൻവാടിയേക്കാൾ ഒരുപാട് മാറ്റങ്ങൾ വന്നു പുതിയ അംഗൻവാടിക്ക്. ഒരുപാട് സെക്യൂരിറ്റിയാണ്. കാരണം നമ്മളിപ്പോൾ രാവിലെ ആണെങ്കിലും അവരെ കളിക്കുന്ന ടൈമിന് നമുക്ക് പുറത്തോട്ട് വിട്ടിട്ട് നമുക്ക് നമ്മുടേതായൊരു ലോക്ക് ഒരു സേഫായിട്ടുണ്ട്. പിന്നെ ഇപ്പോൾ അമ്മമാർക്ക് അവിടെ തന്നെ ആണെങ്കിലും നിങ്ങൾ CSMലായാലും നമുക്ക് പാരൻസിനൊക്കെ ഇരിക്കാൻ വേണ്ടിയിട്ട് ഇപ്പോൾ ഈവനിങ്ങിൽ കുട്ടികളെ വിളിക്കാൻ വേണ്ടി വരുമ്പോൾ കുട്ടികൾ പോകാൻ മുമ്പത്തെ പോലെയല്ല. മുമ്പ് വരുക പാരൻസിനായിട്ട് കുട്ടികൾ അങ്ങോട്ട് വീട്ടിലോട്ട് പോകാം. ഇപ്പോൾ അങ്ങനെയല്ല. നമ്മളിപ്പോൾ അംഗൻവാടി പൂട്ടാൻ വളരെയധികം താമസിക്കും. എന്താണെന്ന് വെച്ചിട്ടുണ്ടെങ്കിൽ കുട്ടികൾ പോകില്ലല്ലോ. കാരണം അവർക്കൊരു പാർക്ക് ആ ഒരു അറ്റ്മോസ്ഫിയർ തന്നെയാണ് നമ്മൾ അംഗണത്തിൽ ഇപ്പോൾ അവർക്ക് കിട്ടുന്നത്. പിന്നെ എടുത്ത് പറയണമെങ്കിൽ കുട്ടികളുടെ വാഷ്റൂം അവർക്ക് തന്നെ ടാപ്പ് തുറന്ന് കൈ കഴുകാനുള്ള അവരുടെ ഹൈറ്റിനുള്ള വാഷിംഗ് ബേസിൻ കുട്ടികൾക്ക് ഒരുപാട് മുൻഗണന കൊടുത്തുകൊണ്ട് അവരുടെ മാനസിക ശാരീരികമായ വളർച്ചയ്ക്ക് അനുയോജ്യമായ രീതിയിലാണ് CSML നമുക്ക് എല്ലാ ഫെസിലിറ്റികളും ഇതുവരെയും ചെയ്തു തന്നിട്ടുണ്ട്.
As a part of scaling of the initiative, we are trying to put a proposal to Kochi Municipal Corporation by providing the solutions to the existing Anganwadis of the Kochi Municipal Corporation area. These things has been discussed with the ICDS team as well as the policy makers of Kochi Municipal Corporation area. CSML will be submitting the same soon for initiating the council approvals for taking it to the next level as a scale-up model for corporation area.
I would like to ask a question to Kochi. How has the Anganwadi play space changed as a public space for community? What are the suggestions to improve these Angans as a community space in the neighborhood?
I am Indu, Child Development Project Officer, ICDS Kochi Urban 2, Ernakulam District, Kerala State. Nowadays, we are all running behind development. We think that development means constructing buildings and other infrastructure. While we are running behind development, we are forgetting our common spaces. Each village or city need some common spaces for informal and formal gatherings. Mostly old age people, adolescent women, girls, and pregnant women, lactating mother, and children. An Anganwadi Kendra is a main focus area of a village or a division or a city. So definitely we can make our play spaces into common spaces for gathering old age people, for their informal and formal talk. We can have some health checkup for pregnant ladies and lactating mothers, and we can arrange some career guidance classes and some discussions for adolescent girls and boys, and for obviously for our children also we can have some play groups, and we can make them to play there after preschool hours. So my suggestion is we can make Anganwadi play areas into common spaces. We can use for common talks for the village folks, and this women self-help group people, they can have assembled there and they can do their works, self-help groups works, and they can arrange some cooking classes and everything, whatever. All purpose we can use our Anganwadi common spaces. Nowadays, meeting people and they are having some informal talk and all this is very rare. We all have mobile phones and we are having laptops. We are all chatting through WhatsApp and Instagram. We are all using smart equipments, everything. So that one-to-one interaction is lacking everywhere. Actually, we know in Kochi, in Fort Kochi and Matranjeri, it's very populated, thickly populated area. We don't have much common spaces over there. Now, our CSML is doing a great job over there. They are making our old Anganwadis, old traditional type Anganwadis. They are changing their faces, uplifting their faces into beautiful framework. They done a great work over there. And they changed that play areas into common spaces for the public people like old age people and adolescent girls and boys and pregnant women and lactating women. They are uplifting their faces very beautifully.
So we just heard from Ms. Indu VS, who is the CDPO of Kochi Urban 2 area. And thank you, ma'am, for sharing that experience. We now move on to the next story. This is story of transformation in Vadodara, and Vadodara city is leveraging CSR funds to improve their Anganwadis, and so far they have been able to do interventions in 35 to 40 Anganwadis. Let's look at their story now.
आंगनवाड़ीज के जो प्रीमाइसेस होते हैं वो इतने अच्छे तरीके से यूटिलाइज नहीं होते कि वहाँ बच्चे जो है प्ले एक्टिविटी कर सके, या जो उनके पेरेंट्स हैं वो वहाँ पर आकर उनको वेटिंग एरियाज में बैठकर उनका वेट कर सके। जो भी हमको पेरेंट्स के साथ काउंसलिंग सेशन करना होता है, पेरेंट्स मीटिंग करनी होती है, तो वो भी वहाँ पर सही तरीके से नहीं हो पाता। हमने उसके लिए एनजीओज एंड प्राइवेट कंपनीज के साथ कोऑर्डिनेट करके सीएसआर के थ्रू हमने एक सीएसआर मॉडल आंगनवाड़ी का कॉन्सेप्ट लिया है, जो है रिनोवेट करवा रहे हैं। आंगनवाड़ी को रिनोवेट करने के बाद जो वहाँ का प्रीमाइसेस है, जो एरियाज है, उसको हमने कंपाउंड वॉल के थ्रू रिनोवेट किया है। वहाँ पर सिटिंग एरियाज हमने मैनेजमेंट करवाया है कि पेरेंट्स आते हैं तो वो वहाँ बैठ सकते हैं। बच्चों के लिए प्ले एक्टिविटी बहुत अच्छी तरीके से मैनेज करवाई है। वहाँ पर इक्विपमेंट्स लगवाए हैं जिससे बच्चों का जो है डेवलपमेंट है, फिजिकली मोटर डेवलपमेंट है, वो अच्छी तरीके से हो सके। रिनोवेशन आंगनवाड़ी सेंटर्स में जो है वो चिल्ड्रंस का एडमिशन रेशियो जो है वो इम्प्रूव हुआ है। 15 to 20% लगभग जो बच्चे हैं उन लोगों का एडमिशन रेशियो जो है वो इंक्रीज हुआ है। एंड बेनिफिशियरीज जो है वो अपने आप को बहुत सेफ फील करते हैं, एक अच्छा एनवायरनमेंट में बात करने के लिए वो रेडी होते हैं कि हमारे जो भी गवर्नमेंट की स्कीम्स है वो हमारे स्टाफ जो है वो बहुत ही अच्छी तरीके से पेरेंट्स के साथ कोऑर्डिनेट करके उनको समझाता है।
રિનોવેશન પછી બાળકની સંખ્યા વધી છે અને બાળકો નવા ચિત્રો જોઈને ખુશ થાય છે। નવા ચિત્રો દોરેલા છે, નવા આકારો દોરેલા છે, ઝાડ છે જેને પર દોરેલા છે, એ બધું જોઈને બાળકોને આવવાનું મન થાય છે। આંગણવાડીમાં કિચન ગાર્ડન પણ બનાવવામાં આવ્યું છે કે જેથી બાળકોને આપણે સહેલાઈથી છોડ કેવી રીતે ઉગે છે, શીખવાડવાની પ્રક્રિયાથી મોટું થાય તે બધું આસાનીથી શીખવાડી શકે છે જેથી બાળકને પણ મજા આવે છે અમને પણ
हमारा अप्रोच है कि हम जितना हो सके उतनी आंगनबाड़ी को जो है वो सीएसआर के थ्रू हम कवर करना पाए। सो दिस ईयर हम लोगों ने अभी तक टोटल 36 आंगनबाड़ी सेंटर्स जो है वो सीएसआर के थ्रू रिनोवेट करवाए हैं।
My question to Vadodara is, when did you start the initiative? Has it positively impacted the attendance of children in the Anganwadi? Also, children from which economic background are attending the Anganwadi the most?
आंगनबाड़ी रिनोवेट करने का जो कार्यक्रम है वो पिछले 2 साल से स्टार्ट किया था, जिसमें इस साल हमने सबसे ज्यादा 36 आंगनबाड़ी सेंटर्स जो है उसको हमने रिनोवेट किया है। इसको रिनोवेट करने से ये फायदा हुआ है कि बच्चों का, जैसा कि मैंने आपको पहले भी बताया कि एडमिशन रेशियो में इंक्रीमेंट हुआ है, वो इंक्रीज हुआ है। देन पेरेंट्स जो है वो अपने आप को एक बच्चों को आंगनबाड़ी में भेजने के लिए सेफ फील करते हैं, अच्छा महसूस करते हैं। पेरेंट्स तो ऐसे हैं जिन्होंने अपने बच्चों को प्राइवेट स्कूल्स में एडमिशन करवाया था, वहां से उन्होंने निकाल कर फिर से आंगनबाड़ी में अपने बच्चों को एडमिशन करवाया। तो ये हमारे लिए बहुत ही अच्छा अचीवमेंट है कि जो पुअर फैमिली से आने वाले लोग हैं, क्योंकि आंगनबाड़ी सेंटर का जो यूज है वो मोस्टली हमारे पुअर फैमिलीज जो है वो लोग के बच्चे जो है वो ज्यादातर यूज करते हैं। तो वो बच्चे जिनको सच में भी रिक्वायरमेंट है, वो नीडेड है और उनको हम गवर्नमेंट की स्कीम्स का बेनिफिट दे सके, इसी पर्पज से हमने आंगनबाड़ी सेंटर्स को कवर करवाया है और रिनोवेट करवाया है कि जिससे बच्चे अपने आप को बहुत अच्छे तरीके से फील करें, अच्छे माहौल में रहे और उनका जो डेवलपमेंट होना चाहिए, जो 6 डोमेन्स पे हम काम कर रहे हैं वो सही तरीके से हो पाए। तो ये कोशिश हमारी इसलिए हमने की और आगे भी हम इस तरह के प्रयास करते हैं।
To Ms. Ambika ma'am, who's the CDP of Vadodara. Thank you, ma'am, for sharing your experience. And we just saw a great case of how CSR funds can be leveraged. Like nowadays, there is a lot of issues with funding such amenities. So CSR funds is a solution for this. Move on to the next story, which is from Bangalore. So far, we have been listening to stories of transformation in Anganwadis. This case is of a maternity health center, and Bangalore is now focusing on providing good quality waiting experience at the health centers. And as a pilot, they had done an intervention at BBMP Maternity Hospital. And let's hear from them now.
In maternity homes and primary health centers in the city, a big issue is the lack of comfortable seating for patients and their bystanders. While hospitals prioritize providing quality healthcare to them after they are admitted into the hospital building, almost all of them overlooked providing for their comfort outside the hospital building while they were waiting. On busy days, when immunization happens, a lot of young families are in the hospital premises and struggle with finding comfortable seating and find it difficult to engage children during their long waiting hours. Most of them are found either being seated on the ground or on the road or on curb edges. We prioritize the BBMP maternity home for intervention after a detailed neighbourhood analysis. We first started off by mapping transit hubs. In our case, it was a Shantinagar TTMC, and around which we mapped all amenities and facilities that are often visited by infant toddlers and their caregivers, like Anganwadis, schools, parks and gardens, and healthcare centers. By looking at the location of these institutions and the location of these vulnerable neighbourhoods, we then picked up intervention sites that were in close proximity to each other, such as the maternity home. While redesigning the maternity home, our focus was on meeting the specific needs of pregnant women, caregivers, and young children. We employed a comprehensive approach involving rigorous data collection through on-site observational surveys, people moving counts, and observing what specific pain points for users were.
As a part of Smart City mission, we have taken up works in developing the unused spaces in public areas like parks, schools, primary health centers, wherein a lot of emphasis has been given for improvements of space for children care and elderly people. And this has been a major success. By having small interventions, we have created a lot of impact, and it is being replicated in other places also. We have, from Smart City Mission, we have done these works at 60 locations. Now, as a part of the continuity of these works, this we have told the local corporation, that is BBMP, that the same can be replicated in other places. And we have been interacting with other departments like Social Welfare Department, Health Welfare Department, to give certain places where such interventions are required for the benefit of the citizens. So this is a exemplary model where we have done all these works, and there are a lot of scope for replication in other places.
बेंगलुरु टीम से मेरा एक सवाल है कि आपने जो इस इनिशिएटिव से क्या प्रभाव आपको देखने को मिला, और आप किस तरीके से इसको आगे बढ़ा पाएंगे, आपका क्या योजना है इसका?
Generally, government hospitals are generally perceived by public to be lacking quality facilities and have poor infrastructure. The pregnant woman and women with young children usually come to our hospital for checkup, and till their turn comes, they have to wait in the hospital. So they usually come along with the caregivers or the attendants. So when they wait in the waiting areas, and if the waiting areas are not comfortable, it adds to their stress. Such facilities with comfortable waiting areas, play areas, walking pathways, plants and herbal gardens makes their experience delightful. Our hospital now does not look like a typical government hospital, and it has seen increase in the input of patients. We get really good feedback from patients. They now feel comfortable during their waiting hours. Fathers or caregivers of the patients are now seen engaging children in the play area when the patients sit for checkup. In the evenings, children in the neighborhood come to play in our play area, and our hospital environment is usually friendly and lively. After the improvements, our hospital has achieved first prize in South Zone Clinical BBMP and got first prize in Kayakalpa. Hospital doctors have visited our hospital to see the changes and now requesting the department for improvements like this in their hospitals. As well as the BBMP maternity home in Wilson Garden has become an example to develop all other PSCs in the city.
So we just heard from Dr. Kaveri ma'am. Thank you, ma'am, for sharing your experiences and insights. We have here with us Ms. Priyadarshini Mohanty, who is a ECD expert, and she would be in a better position to reflect on these cases that we just saw. So welcome, ma'am.
It's a nice presentation. So all of us are very aware that the challenges of urban are common to almost all the cities, like the heterogeneous community. So I just want to reflect here. So challenges we all know, the heterogeneous community, cultural differences, political differences, all are the common causes, which are real challenges, and including all, space is a very difficult challenge in urban location. So here in Odisha also we have so many urban Anganwadi centers. So those centers are running on rental basis. So because of lack of space, so the centers are running on rental basis. So there is no space to sit even for the young children. So to start with, like we all know the challenges, but how to do it, how to sustain the whole effort we did. Like we see the many Anganwadi centers of Kochi, Vadodara, and Bangalore have tried their best with in public-private partnership that they should improve the situation. So I'm not going back to the challenges because challenges we already discussed, and we all know what are the challenges. The challenge here with all of this is how to sustain the whole effort. Like is the government, we should take a call like what to do. So I just want to recall here that we have guidelines for construction of Anganwadi centers and for site selection of Anganwadi centers also, which is applicable both in urban and rural location. But the major challenges in urban location is getting a good space. So, how far we are going with the guideline, that is one challenge, because in the guideline we have that the room size should be this, and the infrastructure should be this, the quality of construction should be like this. And for all of you, there is a provision of 12 lakh rupees for construction of a Anganwadi center in all the locations. And in urban locations, they are demanding more, and there is a discussion going on how to manage that. So in this context, nowhere we have mentioned about how to make it parent friendly, community friendly, you can say, and child friendly in all aspect. So we are just telling them make a child friendly toilet and have enough space to children to do activities in indoor and outdoor spaces. But nowhere we have mentioned that what will be the non-negotiable points. So, if all of you have gone through the national policy for young children, so I think now is high time we should have state-specific policies in which this should be a major concern highlighted in those policies. So, if we'll go through the policies, there is nowhere they have mentioned like how to make it parent-friendly or caregiver-friendly. So, though we have ECC days and other platforms where we are inviting parents, caregivers to the Anganwadi center, however, we don't have any space or we don't have any activities for them. Same for PSCs also. Like we all have a very bad experience that mothers are coming with young children and sitting outside the Anganwadi center because immunization point is many places. Anganwadi center is a immunization point. Same here for VHS India also. Mothers come with young children, and the situation is so bad that, if you will see, the mothers will be worried. Children are crying if they are coming with siblings. Even they don't have space to play, to sit, and there is no facility for a drinking water. Even the basic facilities are also not there. So here I just want to recommend few reflections from the whole thing, like urban policies and missions, whatever smart city mission you can take on any other mission, don't yet acknowledge ECGD as a component in their infrastructure process. Like architects, engineers, those they are not aware about the ECD component. So those smart city is like telling ECD is still not understood by them properly. Like there is no non-negotiable construction key points in smart city mission. Another thing is establishing ECD or placemaking in cities is complex due to lack of land and space. So, in this case, I would prefer here to tell that we must have some long-term and short-term strategy to make the space child-friendly and from parents and caregiver aspect also. So that is one point, and the opportunities can be leveraged if design aids in bringing a convergence of facilities and institutions. So there is a lack of coordination, I'll say here. Then important to strengthen narratives and lobbies towards ECD in the whole country, like the service provider also in PSCs and in ICD structure. I think in ICD structure, the service providers are aware of all those things, but they don't have any control on infrastructure and all. So that is one thing. Then we have to enable technologies also, technologies and data analytics. Nowadays, I think in all states in Odisha, we have initiated already having a software to track the Anganwadi space also, like how they are using the spaces, whether they have a child-friendly toilet or not, and whether they have a space for indoor and outdoor play, etc. So and also we have to capture the data, like what is the migration status to urban population, and what are the available infrastructure, like what are the ECD services, Anganwadi centers, etc. are available. Accordingly, we have to plan, like if this year we have 500 Anganwadi center in a small city, then there may be requirement of more Anganwadi centers in the coming years. So, and how the facility is being utilized and what are the concerns that need to be captured properly, and accordingly we have to treat and we have to plan how to make it child friendly. The other thing is involvement of community. So from sustainable point of view, community involvement is very essential. So whatever we have seen in the presentations, that so a lot of effort the CSR and the public private partnership have done, but how to sustain all these pilot activity, that depends on community ownership also, like the CBOs. Now we can see we have places for SHG people, for community people, we have community homes and community places to have meetings and all, but no one is concerned about the young children. So in the first slide I see that will you send your children to the Anganwadi centers in that particular situation, or the infrastructure, available infrastructure in Anganwadi center? I will say no. Like, I have all this for my young children, and I'll never send them. And when we are calling the mothers, the parents, come to the center, and we want to increase the community participation and parents participation in the whole process, then how? So if we're calling them, we don't have a space, we don't have any activities, and for them also. So, and the situation in PSC is also miserable, very miserable. So when the children's, when the mothers are coming with sick children, and when their children are in NCUs, INCUs, so then SNCUs, so we don't have a space even to sit and stand there. So imagine the emotional stress the mother is having when their child is sick and in this NCUs. So they don't have any counseling facilities, they don't have any space to sit, and they don't have seat for pain. So that situation is also very pathetic. So we want to have community and parents participation in the caregivers participation in the whole process, may it be health or may it be ICDS, but we need to do sufficient arrangements for that. And that is also a very good platform and scope we are getting with mothers and caregivers, where we can like have some interaction, have some social behavior change discussions related to about the young children, the importance of early years, and all that. So we can very well utilize that platform, but we have to plan accordingly. So my suggestion will be for like we know that even if I can say here that CAG recommendation in 2011, there was an audit in infrastructure of Anganwadis. So they have also suggested few good recommendations related to how to make the spaces caregiver and child friendly. But though there is a scope in the guideline and we're providing money also for that, we don't have a proper guideline how to do it qualitatively. So there is space, enough money, but we don't have a proper guideline how to make it caregiver friendly. So that need to be highlighted. So again, I just want to say 18% of the world's total population are in there in India. So 9.7% of this is in state total child population, whatever the child population is. So with a this is our country is a young children country, you can say, because major under 5 population are there in India. But infrastructure wise, though we have structures, so we don't have enough non-negotiable things in the structure which can be used for make it child and caregiver friendly. So this is one thing. So so in order to address that, ULBs can help us a lot, so from sustainable point of view. The audit, so we to not only the audit, and then be department who is responsible. We need to have lack of convergence between departments. If you'll say that ICDS, the WCD department alone or the health department alone cannot address this issue. So we need to have a convergence with roads and building department, water resource department, SSCPD department to address the disability, the children with disabled, those who are coming to the centers or the PSCs. Then we have health and WCD in place. So health and WCD needs to have a proper convergence with all these departments to make the infrastructure and the public places available to make it a child and caregiver friendly place. So here I'll suggest that we must have a long term and short plan both, because in urban places space is a challenge. So we cannot fight with having more spaces. So, um, Signs can also be adapted if we are planning, like if we don't have much spaces, vertical designs can be like planned, like how to do it vertically child sensitive. So we don't have play spaces in urban areas, so how the rooftop can be used as a place to play, and specific arrangements can be done in that area. So that is one thing. And in long term planning, policy level changes is highly required. If you'll see, the R&B people are not much oriented about ECD. They don't have enough knowledge that how ECD is very important when they are doing something, some designing in from infrastructure context. So we have to revisit and rebuild the concept of ECD with all the officials, all the decision takers, and with the I'll suggest the national ECC policy need to be revisited in terms of quality infrastructure to make it public friendly. So this is about one thing, and we must have citizen networks. The CBOs need to be oriented. So they should take the ownership of all those spaces. Like we have infrastructures, you can see, and if there is a footpath, we want to make it child friendly. Adults have a interference in that. If it is a park which we are making child friendly, then adults need to take care of that. So ownership is one concern. So there should be CBOs who should own the things and take the maintenance aspect also. And both service provided and the service provided in terms of medical officers, the ICDS officials, the ANMs, the ASAs, they need to be very much oriented that how to make this place user friendly. So these are all, and behavior change is one aspect, the other aspect of the whole thing. So the parents, the citizens of the particular urban community need to have proper orientation. Like we must have some SBCC, social behavior change aspect, like sexual behavior change activities planned with the community people, with the SHG members, with the adolescents, the youths. So, and they should own the property, like own the government properties, and they should have the ownership of whatever is there to maintain. Maintenance is also a challenge. So though we create the spaces, maintenance is a challenge. So this is all, and uh, so the thing is, everything is good in at pilot phase. So when it comes for sustainability, we need to take the help of government. So the government structure is huge, and there is no scarcity of money. The thing is, we have to strategize the thing properly. There should be a proper use of data, and we should analyze and interpret the data properly. And the public should have a very active participation in the whole process. What are the challenges, and culture also need to be addressed properly. In a heterogeneous community, in urban population, people come from many community, many culture, and leadership is also a challenge there. So we need to address that also. So I think from my end, I'll suggest that sustainability is a challenge in the whole thing, but the effort is very nice. So we need to align with the government policies and government funding structure, and to make it sustainable. But the essential thing is here that whatever is available right now, let us start with that. So we need to have an immediate strategy, and we should also plan at policy level for long-term sustainability of the whole approach. The concept is very new, so awareness building, orientation of the policy makers, the decision makers, is important here. So this is all, and if there is any question also, I'd like to address.
Thank you so much, ma'am. It was really insightful, and your points about importance of having a national and state level policy and having guidelines in place that ULBs can easily adopt is also something that we are trying to do with the cities. And also the emphasis on the participatory planning and involving all the stakeholders from the scratch to the implementation, also to taking it to the maintenance of the projects is something really crucial. And we have been also trying to use some of those participatory tools in the projects that were showcased. And thank you so much, ma'am. And I think we also have some questions in the chat box, which are also targeted to the cities cases that we had presented. And also, ma'am, I think you also have got a question on what is the process in which city can adopt design guidelines to design ECD centers.
There is already a guideline from Government of India for designing the ECD centers, and I think state have a crucial role. Like they can modify that on the basis of availability of space, availability of raw materials. The amount is fixed for all the states. I think it's a 12 lakh budgeted amount for one ECD center, and state have a flexibility to plan it on their own. So there is everyone can refer that also. I think it is in website. Otherwise, I can share Visakha, the guideline for construction of ECD centers.
Sure, ma'am. We'll share across the network.
Yeah. Apart from WCD ministry, MWCD have a provision of 2 lakhs, I think, which is in 60-40 ratio. And MGNRAG also have some source, and Panchayat Raj department also supporting for that. So for urban, I think there is another flexibility. State have the flexibility to take a decision based on the requirement. So it will be different from or for urban location from state to state.
Right. Thank you so much, ma'am. And there was also a question on how are these interventions impacting positively in the development of children. Some of the cities I can already see that Kochi is answering to those questions. They are typing in the chat that providing play elements are helping in the overall development and making them more active in using the spaces, which is contributing to the positive development of children. And yeah, in case you have any question for ma'am, any of the participant can type in.
I just want to add here, we have Saksham Anganwadi program for all the across India. So there is an additional fund provision in Saksham Anganwadi. So all states are assigned with few numbers of Saksham Anganwadi. Just say we have 6,000 Saksham Anganwadi in our state. So specifically, Government of India have advised for, and it is different from state to state also. So there is an additional provision. I think for Saksham Anganwadi they have 1 lakh rupees, in which the ECC component is there, including the infrastructure. The whole thing is that how we are monitoring and the quality component of that. And state have all liberty to add the quality component to that. State can do their own guidelines in that, like how to make it non-negotiable from child safety and child-friendly point of view. So that is one thing. We have co-located Anganwadi budget for co-located Anganwadi centers. I mean ECD centers, those who are located inside the school premises. So there is an additional budget in ECC component again in that. So there is no scarcity of money. So fund provision is there. So we just have to ensure that that should be used qualitatively when we are constructing a ECD center. We are planning to develop a ECD center.
So much, ma'am. And in respect of time, I think we can keep the further questions and replies to the chat box. So I would now request our program director, Mr. Sri Kumar, to give closing remarks and insights on how should we take this forward.
Thanks, Priyadarshini Mohanty ma'am and others from the representatives from the cities for their great insights, and also for all the coordination in realizing these projects. This has been quite a enriching journey on working on Anganwadis through the Nurturing Neighborhood Challenge. I will say few things, some observations. if we see most of the places, these Anganwadi as a projects where have happened, they have almost become as public spaces, right? These are the places Anganwadis have were also located in communities where there is very much lack of public spaces were there, and especially women who were taking care of the children and going there to drop the child and come, and in the whole day the access to public space for them is very limited, right? So they and there is also time poverty. They don't have much of time to go to any park or garden most of the times. And there is a so finding converting Anganwadi into a reimagining as a public space has worked really well. So this has helped the community, especially women, to congregate, to meet with each other, to talk about the issues. It gives a very safe socio-psychological space, right? I mean, where they can share and with their similar kind of mothers and so on. So probably this idea of this reinventing Anganwadi as a public space in the community is somewhat really a powerful idea, which is which we have tested through the Nurturing Neighborhoods Challenge. And also Smart City Mission has done quite some number of smart Anganwadis. And so however, these are very small parts, right? We have around 15 lakh Anganwadis across the country. There are so many of them. If we can reimagine all of this and see that how they can become like a community spaces as safe spaces where women, children will spend their extra time. They will meet, they'll congregate, they will celebrate festivals, they will do some economic development related, livelihood related activities. They will meet some health professionals. They'll get some support. All of this, if these can happen as Priyadarshini ma'am also spoke about, this whole idea of co-location seem to be quite successful, and how we can really bring this together as as an idea. We always co-locate things with Anganwadis, with other related amenities, related facilities where women and children can get benefited. Then this can go really a long way in creating this safe space as public spaces for the community, especially for the most vulnerable people who needs them. So the other thing also being spoken through this discussion is also what ULBs can do about it, right? For ULBs, I think the example of Kochi is an excellent example where the ULB has really championed in partnership with the women and child welfare to think about how to convert this into great spaces. Similarly, Bangalore has really reinvented the idea of this maternity home into a really a vibrant space, which is not just stressful but also like a space where the children don't mind going, that kind of a thing. So these examples, these are done by government agencies. These are ideas are totally by conceived and implemented by government agencies. That says a lot. So this is very much something which we can scale up across the country. And how do ULBs can play a key role? Even this idea of the height of children height wash basin we saw in Vadodara and we saw in Bangalore and other places. So how we can mainstream this idea across Anganwadis, and not only Anganwadis, every public space where children are expected to be there, then we need to have this kind of a space where the ULBs can really think of such ideas as a mainstreaming opportunity. This is not going to cost more. It is the same fund we'll be spending. We'll have to. It's just the idea, the intent need to be made, and it will go a long way in making the spaces more friendly, right? Friendly for the people. Why do we need to follow certain standards for of very different standards, where children are spending most of their time, right? So probably it's a time to rethink all of that. How to institutionalize in the municipal corporations, in the all the government agencies, how to make this as a really mainstream work will be somewhat something to discuss. We have also tried to discuss this through the 100 odd projects of around Anganwadis and public health centers we have done through the Nurturing Neighborhoods Challenge. These 10 cities have really showed many of these, especially the cities who presented today have really shown a very concrete way of how to take it forward. We really thank the city representatives for all their time in making this possible. On our part, from WRI and Bernard Van Leer Foundation, with the support of them, we have prepared kind of a toolkit and guidelines for how to reimagine Anganwadis as a public space and public health centers. So we will be soon we will be coming we'll be putting out in the public domain to help all the cities and others to be able to use this, and hope that this kind of discussions and sharing help the people working around these areas, the fraternity who are thinking on the ways in which we can make public spaces and also for children and early childhood development. We are very happy to have this discussion going forward. This is just a starting, and there will be many more things we need to do. As we were saying, the number of Anganwadis and the government machinery, we need to move is huge, and we will all work towards that. We would like to thank Smart Cities Mission, Ministry of Housing and Urban Affairs for hosting this challenge, and also for helping host this webinar. And I would like to thank Bernard Van Leer Foundation for their support in making this possible, and also would like to thank WRI team members for making it possible, and of course the cities who have done this displayed this great work. Thanks a lot for all of you. Thanks.
I would like to thank all the participants for joining this session, and all the speakers who have given really good insights, and our key speaker, Priyadarshini ma'am, for joining in such a short notice. Thank you, everyone, and thank you, WRI team.